All right, good afternoon, everybody. Thank you so much for joining us for today's speaker series. My name is Stephanie, and I will be monitoring things here on the back end. If you have any questions or comments, feel free to put them in the chat. I enabled that for everyone to use. If you have any questions and you want to put them in the Q&A, you can also put them in the Q&A. I'll be kind of monitoring each of those. After this event is over tomorrow, you will receive a follow-up email, and it has the link to the Qualtrics evaluation. So please fill out our evaluation form. We appreciate your feedback and would love to hear about other topics you're interested about learning in the future. Our next speaker series is going to be in person. This will be at the University of Michigan Detroit Center, and Dr. Bruno Giordani, he's going to be doing an AAIC research update. So he's going to be talking about all of the new research that is coming in the fields of Alzheimer's and related dementias. The date of that will be August 27th, and it will run from 10 a.m. to noon. We have lunch. It's always a really nice time, but I'll be sending that information to you. So you have that as well. And without further ado, it is my pleasure to introduce Dr. Lenette Jones. Dr. Jones is an associate professor at the University of Michigan School of Nursing. Dr. Jones received her PhD from the University of Michigan in 2014 and completed a postdoctoral fellowship at Case Western Reserve University in 2017. Her interests include hypertension self-management, health disparities, neurobiological mechanisms of intervention, like MRI, and health information behavior. And with that, Lenette, I will turn things over to you.
Okay. Thanks so much, Stephanie. And good afternoon, everyone. So excited to be here with you today. Let me just go ahead and share my screen. And okay, does that look okay, Stephanie?
Yep, looks good.
Okay, wonderful. So thank you so much for having me today. Dr. Giordani is one of my mentors, and we still work closely together. So I'm excited to hear that you'll get to hear from him as well. And he's had quite a bit of influence on the work that I do. So today we're going to talk about pressure points, and really just understanding some strategies that you can use to control your blood pressure and protect your brain. So if you ever heard me talk before, I always have goals and objectives for both myself and for you as an audience. And so what we're going to do today is we're going to start with a brief overview and just talk about how the brain and the heart are connected, what exactly is blood pressure control, and why is it important for brain health. I'm also going to share some pressure points with you. And what I mean by pressure points are strategies that will help you maintain your blood pressure levels in a safe range. And then I want us all to consider next steps. And so, whether you are a patient yourself that is working to control your blood pressure, or if you're helping a family member or someone that you care about, if you're a healthcare professional, all of us can think about strategies to help those in our community or help ourselves to better control our blood pressures and maintain our brain health. So let's get started. Oh no, actually, you did hear a little bit about my background. I just like to share visually as well. I think it's important whenever you hear from a speaker that you understand their lens and perspective and how their views have been shaped. And so just so you know, I'm a registered nurse. You heard that I received my education at University of Michigan. And when I was at Case Western, my postdoc actually focused on brain behavior connections. And so I'm faculty and endowed chair in the School of Nursing at University of Michigan. And my program of research has always focused on the same problem. And so really achieving health equity so all patients have the same opportunity for self-management strategies and to maintain their blood pressures within a safe range. And so we're going to start with the overview that I promised you, just really understanding and doing some basic housekeeping so we're on the same page of how the brain and heart work together, and how we can control our blood pressure and what do we actually mean when we say that. And so the heart and the brain, they work together in many, many different ways. Today, we're just going to focus on a few highlights so that we can understand what the heart is doing when it's pumping and how that helps the brain. And so when your heart pumps or contracts, it supplies the brain with blood, and that blood has nutrients. So, glucose, oxygen, all the things that your brain needs to function. And so, when you function, it's basic things like breathing, moving, making decisions. Particularly today, we're going to talk about how you make decisions on how to manage your health. But all those things are in place, and that's what we're really interested in focusing on today. This relationship of the blood flow getting to the brain and then the brain helping us to make some executive and important decisions. And so when the heart pumps, each with each pump, the arteries are taking blood from the heart and delivering it to the body. So again, we talked about oxygen, glucose, and particularly we're talking about what is going to the brain right now. Blood pressure is the measure of that force. So each time that your heart contracts or pumps, we're measuring the force against those arteries. And so let's talk about that a little bit more. So actually, when I was at Case Western, the sprint trials came out. So around 2014, 2015. And so the sprint trial was actually talking about optimizing medication control and blood pressure. And they actually had to stop the trial because it was showing that all the patients, once you optimize that blood pressure level of less than 120 and less than 180, those patients were doing so much better than the patients in the comparison. So they had to stop the trial, and that's where we came with the new recommendations. And so if you were treating patients prior to that, like I was, we used to focus on 140 over 90. But now we've learned that really that 120, less than 120, your top number, and less than 180 for your bottom number is really the best space for you to be with blood pressure control. Now, of course, that is specific and unique to each patient. And so these are numbers that you should be talking with your provider about. But for this conversation today, when I say normal blood pressure, I'm referring to less than 120 systolic and less than less than 80 diastolic. And so let's talk about what that means in the actual artery. So over here on the left, there it is. Over here on the left, this is normal pressure on the wall. So we talked about the contraction and we're talking about the number less than 120 over 80. So this on the left is normal pressure on the wall. As you can see, there's no damage to the artery here and there's no restriction to blood flow. So when we're talking about this transport system and getting nutrients to the body, or in this case, the brain, there's nothing preventing that from happening here. Now, here is the increased pressure on the wall. So as our blood pressure levels go up. So say here we're thinking about a blood pressure 150 over 90, right? So it's over that 120 over 80 that we talked about. So here, two things are happening. One, with that increased pressure, there's damage to the wall, the arterial wall here. And also with that increased pressure, there's less opportunity for blood flow here. So there's less opportunity to deliver those nutrients that we talked about that are so important for function. And as this happens over time, you can see that the wall is damaged and the body is great. The body works to repair itself, right? But as you repair, that makes that area more susceptible to plaque buildup, especially if you have things like high cholesterol. And as you can see, what's happening here is it's further narrow. So the opportunity for delivery of oxygen and glucose and all the things that we need is reduced because of the damage, because of the increased pressure, and then the plaque buildup in the artery. So let's talk about neurons. So this is specifically in the brain. The neurons make up the brain tissue. So over here on the left, this is a healthy neuron that is getting all the blood flow and nutrients that it needs. But look what happens to this neuron on the right. And so as they're damaged, you can have changes in cognition, or we talk about MCI, mild cognitive impairment. There's all sorts of things that can happen when you have damage to the neuron here. And so in words, when your blood pressure gets too high, or maintains, high levels that aren't controlled across time, it puts you at risk for a stroke. Also, cognitive decline. So, what we just talked about, mild cognitive impairment. And so, when you think about self management of a chronic illness or just self management in general, what am I going to eat? How am I going to be active in a day? How am I going to take care of myself or take care of my loved ones or those around me in my community? The ability to make decisions is reduced because you're not getting all the things that you need to get to your brain. And when this happens across time, the long-term damage to those neurons and to those blood vessels, that puts you at an increased risk for vascular dementia. But lucky for us, there are ways that we can control our blood pressure and ways that we can be in charge and self-manage our blood pressure. So there's ways that we can eat better. The DASH diet, which we're going to talk about today, is the gold standard right now for managing blood pressure. We can reduce our sodium, we can be more active and control our weight. We can limit things that may not be so good for us, like alcohol, and really be thoughtful about loving ourselves and practicing self care and stress management techniques. And so I'm going to talk about almost all of these today. Very briefly, again, this is an overview and just a reminder connecting with a provider and having a relationship there where you can talk about these things in depth during appointments or send messages. That's really important to have. All right, so let's get into the pressure points and the evidence-based strategies that we can employ to maintain blood pressure control. So the first one, we're just going to talk about ways that we can eat well. And like I said, I always put my audience to work. So I want you to think about as I go through, what are some things that you can take away and implement in your life or talk to a loved one or someone that you care about eating better. Or if you're caring for patients, what are some things that you can discuss or suggest from what we talk about today? So first, this is an image of the DASH diet. And I'm sharing this first because this, again, is the gold standard. And so I won't go through the entire pyramid, but you can see at the foundation, vegetable and fruit intake is very important, followed by grains. At the top are those things that you are supposed to take in less often. So sweets, here, and it'll be a little bit different. We're going to talk about the Mediterranean diet as well. So here, oils are at the top. Olive oil is a big part of the Mediterranean diet, so just a slight difference there. Lean meat and poultry, low amounts of dairy, but you can see you focus most of your eating at the bottom, and then at the top, you're more thoughtful and have a less amount of sweets and things that you take in. So why the DASH diet? Again, so the DASH diet is focused on low sodium and low fat. We know that sodium has a direct influence on our blood pressure, our salt intake. On the DASH diet, you may see lower blood pressure levels within 2 weeks of beginning to follow it. And then there's evidence that your top number, your systolic blood pressure, may decrease by 8 to 14 milligrams of mercury. So think about it. If your blood pressure, when it's measured, it's 130 over 80, you start following a DASH diet. And then so you can see 10 is right in that range. So you can get your blood pressure level down to 120 over 80 just by following a better eating pattern. And so there's plenty of benefits from the DASH diet, but prevention really of heart disease and stroke. So some of the things that we talked about at the beginning of the presentation. Now, this is the Mediterranean diet. Mediterranean diet has actually been studied quite frequently in studies that have to do with the brain and brain health. And so I bring it up here again. So you can see at the bottom, fruit and vegetables is still the foundation. You can see olive oil, they include here in the foundation. But you see, we don't talk about any other oils. And so that's one slight difference there. You can see sweets are less often consumed, just like in the DASH diet. Water is important, wine in moderation. And so, again, this is a conversation that should be had with your provider, with a nutritionist. But this is an overview about a healthier eating pattern that we have evidence is helpful. Now, at the bottom, I'm going to talk more about this later in the presentation, but I like that they included it here. So, being physically active, enjoying meals with others. So, eating is very social, right? And I'm going to talk about some strategies of if you're cooking for others, how do you negotiate eating less sodium? How do you talk to your family about the fact that maybe you are diagnosed with hypertension? You have to be more thoughtful about what you consume. And so all of this, I think is important to take within context. It's not just as a provider, I give you a handout and you follow this diet. You really have to be able to think it through and make a plan for how you can successfully follow a different eating plan and do that within the context of your family or whoever else you are eating it with. Just to share some evidence with you. So we know that the Mediterranean diet can help prevent brain tissue loss. So that unhealthy neuron that I showed you at the beginning of the presentation, we can help prevent that. I told you the Mediterranean diet is very close to the DASH diet, so it's helpful in reducing those blood pressure levels. And really, so those things help reduce the risk of mild cognitive impairment or cognitive changes, Alzheimer's disease, and by preventing damage to that neuron. So making sure that the neuron in the brain gets the blood flow and nutrients that it needs. I want to transition just a little bit away from thinking about this as a diet plan and just thinking about intake in general. So we know that sodium, the more sodium that you consume, the more water that your body holds on to, and then that additional water when you pump your heart, there's more work and it raises the blood pressure to move that extra fluid throughout your body, right? And so we talk about reduced sodium, but a lot of times people don't necessarily think about what that means in real life and context, right? And so I like to show the picture of the Salty Six. This is taken from the American Heart Association, because sometimes we don't think about, I'll give you a personal example. There's a lot of patients that I've worked with that thought that they were eating soup and so then that because they were eating soup, it's not fried, right? And so therefore it's healthy. But one can of soup can have as much as 940 milligrams of sodium. And if you think about it, if the recommendation is around 2000, that's over half your sodium intake for one day. And so I thought it would be helpful for us just to take a moment and think about there's there could be high levels of salt in bread and rolls. What you think about the crust of your pizza, the bread on your sandwich, the wrap for your burrito. In cold cuts and cured meats, salt is used to preserve them. So when you think about the pepperoni in your sandwich or lunch meat, there could be additional salt there. We already talked a little bit about soup, or let's think about tacos and pizza. Sometimes cheese also has quite a bit of salt in it. And so I think it's very helpful to think these things through when you're thinking about meals that you make or what you're going to eat at a restaurant. Just thinking about the sodium content that's in there. And that's why when you think about the DASH diet and when you think about the Mediterranean diet, that the base it's fruits and vegetables, right? Because we know that there's no preservatives or salt that are added there. So just something to think about. And so here's our healthy brain helping us think things through and make good decisions. This is the first of 3 times that you will see the brain today. And so this is where I'm going to pause and just ask you all to take a moment and think about what we talked about for diet today. So whether you are a patient yourself, whether you work with patients, whether you have a loved one that you are making meals with or for, what are some ways that you can either reduce the salt or think about increasing more fruits and vegetables or anything that we talked about in this first section on diet? So I'll pause for just a minute and just see what some of the ideas that you have in the chat. I'm actually going to grab some water while you all do that. All right, I'm not seeing anything pop up on the chat yet on my end, so I'll just give you a quick example before we move on of ways that I have worked with groups in this. I worked with a group called Jack and Jill, which is moms that are interested in helping their children do better or and themselves do better. And so we talked about the fact that one family was doing a pizza night every Friday night. And so we already talked about pizza can have quite a bit of sodium. In addition to sodium, just the calorie intake and the amount of fat. And so we talked about a couple of things, maybe negotiating so that pizza night is twice a month instead of every Friday. Being thoughtful about the fact that you don't know the pizza that you order from a certain place, how much salt is in there. So perhaps making pizza yourself at home, and that way you can control the toppings, you can look at labels and see how much salt is included. And so there were some ways that they thought about living healthier lives and showing their children how to do so. Thank you, Sandra. I love this idea, homemade soup. So similar to the homemade pizza, right? Being thoughtful about your ingredients. So you control the ingredients when you make your soup at home rather than going to order it from somewhere else and you don't know how much salted butter they use. You don't know what seasonings are necessarily in there. So controlling in that way. Thank you so much for your suggestion and ideas, Sandra. Okay. And so we'll keep the wheels turning if there's anything else that you want to share as we move forward.
Yeah, there's one more question in the Q&A.
Yes.
Yes.
Let's see if I can. Oh, under more. Okay, got it. I've been advised. Um, so, Kristen, that's a great question. And so I think I said at the beginning, depending on what other conditions you have, so this is a conversation that you for sure will have with your provider and your nutritionist. Um, I would suggest just keeping an eye on your blood pressure. There are plenty of countries, like for example, Japan, their sodium content is much higher than us in the US. But because of other factors, hypertension may or may not be an issue. So it's just something to monitor. If that is a high sodium content diet is something that you need for some other condition that you're working to manage, I think that's fine. But keeping an eye on your blood pressure for sure is really important and something you should keep in touch with your provider about. Um, get uncured lunch meat if it's available. Absolutely. Another great idea and another great strategy. Thank you so much, Deborah. Okay. All right. Point number 2, be active. Um, so 1 in 5 of us engage in the recommended amount of daily physical activity, and whether that is getting up and moving every hour, number of steps, minutes of exercise, there's only one out of every 5 of us who are actually doing that. But we know that exercise is great for us and can mitigate some diseases, especially one that we're talking about today, hypertension. Um, and so I want to focus here. There are many, many, many benefits of exercise, of getting your heart going and your heart rate up. But we do have evidence that it directly, as you exercise more often and engage in it frequently, you lower your blood pressure. So many benefits, but we're going to focus right here today. So, specifically for the brain, regular aerobic exercises enlarges areas of the brain responsible for language and learning. And so, I want to highlight two things here. First, that means that we're getting blood flow with the nutrients to where we need it. And then again, with language and learning, we're able to interpret self management strategies that we're talking with others about. We're able to make decisions on how we are going to choose uncured meats instead of cured meats, right? And so these things are really important. Exercise helps us get our blood flow going so that we can make some of these critical decisions for self management. So I like to show this infographic here just to show a variety of exercises. And so one of the myths about hypertension is that you have to engage in extremely vigorous exercise to reduce your blood pressure level, and that's not the case. The case is what exercise are you going to participate in, right? And what are you going to do routinely? What are you going to add to your daily calendar that you're going to get done? What do you enjoy? And so, whether that's walking, yoga, swimming, some type of sport, breathing exercises are really important. And we'll talk about that later as far as stress management, but exercise that you participate in, those are ones that are helpful. And so, again, thinking about maybe old injuries or other things that you have to consider, talking with your provider before you start any exercise regimen is really, really important. But there's a variety of things that you can do to participate in and be more active. I see a question here. Previous lane control is higher than it should be. How does that affect the so it depends on what is happening in your body. But in theory, if you have a higher cholesterol level, that is where you can get additional plaque buildup in in your vessels. And so, if you have higher cholesterol levels, it's important to work with your provider. There's imaging that we can do. We can monitor your blood pressure levels. I'm sorry, your blood levels of your cholesterol to see what is happening in your body. There's medications that can be offered. And so, again, it's important to work with your provider to talk about where your blood pressure, I'm sorry, your blood cholesterol levels are and what you can do to address them. But in general, that the slide that I showed with the additional plaque in your artery, that's what can happen with increased cholesterol levels. Let me see, is that the same? Okay. All right. And so we just finished talking about exercise. I'm going to ask you again to consider how can you help yourself or a loved one or patients to be more active. And so I'll tell you a little bit while I'm waiting to see what your responses are in the chat. I actually developed and am testing a mobile app right now that focuses on Black women who are interested in managing their blood pressures better. And in that app, for exercise, we talk about the importance of exercise, the science behind exercise, and then I ask them to do two things. One is to consider a variety of exercises and what they're interested in. And so I put links to yoga, links to Pilates, links to chair workouts. So for those who may be less mobile, they can start working out in a chair first rather than doing something that is standing or on the floor. And then the other thing I asked them to do is to think that through. Um, with a partner or with a peer. And so, what exercises do they like? Can you go and do them together? Can you do them together on Zoom or on FaceTime? Or if that doesn't work, can you plan to do them? So, like for example, my sister is in Brooklyn, New York, and sometimes we'll say, okay, we're going to work out at 10 a.m. this day. And even if we're not together, we have that accountability to each other because at 11 we should be ringing each other's phones talking about what we've done and what we've accomplished. And so really that partnering and thinking through, okay, who is in my village and who can help me be accountable and think through these things. Because sometimes, and I'll say this about the app, sometimes we don't know where to start, or sometimes it's been such a long day, we're not sure what we want to do. And that's one of the things I think my participants reported enjoying about the app is they could go in and say, okay, I know I need to exercise. Dr. Jones listed these things, and they were able to click on links and pick an exercise for that day. So it took some of the guesswork or some of the planning out of it. So I don't see anything. So if you have any, oh, here's one in the chat. I try to exercise while listening to lectures like this or podcasts, just walking or riding a stationary bike if you have access to one. Absolutely. That's a great idea, Kristen. Thank you so much for sharing that. I have several colleagues that have standing desks that walk during meetings, or when I'm in the office, I try to get up every hour and move around, even if it's just for a few minutes. So I walk the perimeter of the School of Nursing, or, if it's cold outside, I walk the floors in the School of Nursing. Um, there's also, I think, at least in the School of Nursing, there's a path that talks about how many steps that you've taken, or there's a path like through the school that talks about it's either length or number of steps. But that's a strategy. We live in Michigan. If it's snowy outside or raining or 90 degrees like it is today, thinking of alternatives so that you can still be active. Thank you for your comment, Kristen. Okay. So let's move on. So I usually in my presentations focus on diet and exercise. I thought stress management would be helpful, just given the current climate of the world right now. There's so many things going on, and really thinking about stress and how that relates to blood pressure and how we can care for ourselves. So that is our pressure point number 3. So this is actually taken from a study that was conducted in Harvard. Stress management is often one of the most overlooked strategies for preventing and treating high blood pressure. And so I'm just going to briefly mention each of these. I'm going to highlight some and not others, but I think we'll have enough time, excuse me, at the end to go a little more in depth if you're interested. So sleep, very, very important. That's when your body has a time to repair itself. That's when you have a break from all the cognitive activities that you're doing during the day. Sleep is extremely important. There's also studies that show number 2, relaxation, so meditation, mindfulness. There's all there's many studies that have been conducted that show that there's evidence that mindfulness is a great technique in helping to lower blood pressure levels. My research focuses on strengthening your social network. So, how can you connect with your family members or your coworkers or your friends in order to better manage your health? And I have a few things I'm going to share with you from my research as we continue on the presentation. Honing your time management skills, I'll just say thinking through your grocery shopping list in advance, thinking through what your exercise plan is going to be for for that day. That's helpful. So then you don't get home from your work day at 6 p.m. and then you don't know what to make for dinner and you say, let's grab pizza. And pizza is great in moderation. I'm not trying to give pizza a hard time, but that's something quick that we can order and pick up. But really thinking that through, can we have some things in our refrigerator already so that we can make a healthier, less salty option? Or can we already have a plan in place for exercise? And that way we're not sitting there at 6 p.m. trying to figure it out, tired from our day, from all the cognition that we had to use, all the cognitive decisions that we had to make. It's very helpful to be able to plan that out, time management. resolving stressful situations. That could be a whole nother presentation. But I will say very quickly, just thinking about working with your provider, right? Does your provider talk to you like a partner? Do you feel valued in that relationship? It's so important, as you can see, the negotiations and conversations that you have with your provider about how you want to manage your care. You want to make sure that you have a good relationship with someone that you can and talk to and feel comfortable speaking up about what you need. Nurturing yourself, I just want to highlight taking a walk there. Walking, I think, is just an excellent tool for blood pressure management. And then asking for help. And so I've talked today about family members, I've talked today about providers and those around you. Even so, in a work environment, can you have a conversation about options that are available in the vending machine? Is water available? Are there walking groups? So, really just talking with all of the folks in our community about how we can reduce stress or, be more active, the tools that we need. I think all of those things are really, really important. So, I just want to share a couple of research findings with you. In one of my early studies, I asked individuals why they were sharing health information. Mine was particularly about blood pressure. And so most people were telling others things that they knew just about high blood pressure in general, or giving advice or encouragement about preventing or treating high blood pressure. And so I think that's really important just because as we become aware of more strategies, of new recipes, of uncured meats, of thinking about ways that you can, make things yourself. I think all those things are really important, and having conversations about those things are important as well. Recommending healthcare providers, and so I just talked about that a little bit, but someone who is going to listen with you and talk with you about strategies that you think you can be successful at and employ yourself. And add to your self management routine. Having that partnership is really, really important. Less often was giving documents or internet links to others. And that's probably just because this was a population of women who were not necessarily healthcare professionals. And so that's not necessarily an activity to participate in. And then the last one, the blue one, is actually talking with a healthcare provider about the strategies that you employ. And so I think, again, considering your healthcare provider and someone that you talk with, especially now that we have not just phone or in person visits, but you can do virtual visits, you can send messages back and forth. So just making sure that you're in communication with your provider or providers. Another study that I conducted, so I asked women specifically when you are sharing health information, I really wanted to understand the meaning and context behind it. And so I did not set my interview guide up like this, but the women told me the who, what, when, where, and why of sharing and why that was important. And so you can see, again, they talk with peers. This woman was talking with her daughter. Her daughter had been recently diagnosed with high blood pressure. And so she wanted to help her change some of her habits. Um, Another participant talked about doing good in the neighborhood, passing out recipe cards. And so we talked about soup today or making our own pizza. One of the students in my lab, I'll tell you about that a little bit later, but brought forth a salad dressing, an olive oil based salad dressing that was very easy to make at home. And so we actually recorded the student doing it and put it on our social media research page. But really, if you have an idea about a seasoning, that's great. That doesn't have that sodium content, sharing it with others. I talked a little bit earlier about exercises in a chair, but thinking about some people. May not feel comfortable being outside. Some people, because of the sun, because of the neighborhood things. So, how can you exercise within the safety of your home, or have you found a class that you really enjoy? I really like this last one I'm gonna highlight. If I can give a word of encouragement, I want to try and help. And that's one of the things that I am learning about self-management strategies is that they're not only good for the person that you're sharing them with, they're good for yourself. It means you own the information. There's some feelings of altruism. And so you are working to help others, but it really makes you feel good about yourself. I've also learned that to share health information, individuals really have to have a good understanding of the information themselves. And so that helps with learning and being able to understand and interpret and then share the information with someone else. So, actually, a very, very important strategy. And I'm really excited about the work that I'm conducting right now to base interventions off of this information sharing concept. I also learned so many of the participants that I was talking with, they are grandparents. And so they were really interested in preventing hypertension in the next generation. And so, again, that comes along with giving context and meaning to these self management strategies. And so, maybe reducing my sodium may not be a priority for me, but if I want to teach my grandson or children or whomever it is about strategies that will be helpful for them so they don't have to worry about blood pressure management or taking pills or whatever it is, that context and meaning has been really important to some of the women that I have talked about. And so they talked about gardening. With their grandchildren. They talked about exercises that they participated in with their grandchildren just because it was more meaningful and they were being more purposeful in doing that. And it was a helpful self management strategy for them because they were still participating. This is taken from a study that I conducted when we were still at Case Western. So these are my co-investigators here down at the bottom. And so, what I want to just highlight here, we talked about communication. Now, see, they say it's a common stressor, right? So, really thinking about how do I talk to my family about these new strategies that I want to put into place? And actually, in the mobile app that I developed, I actually developed a strategy or almost like a template for a conversation to have both with family members when you're making dietary or exercise changes, as well as creating a template for talking with providers. And so that way, when you get to your provider, you already have a list of questions or concerns or topics that you want to discuss rather than getting there and saying, "Oh, I completely forgot of everything that I thought of." So just writing down and having that prepared. We talked about better sleep, why that's important. And then here thinking about if you don't want to call it a diet, right? Or you don't want to talk to your family about dieting, calling it healthy eating or lifestyle changes or whatever is important to you, but really thinking through these things and how you can do them as an individual and then in the context of your family or whomever you talk with, or in a larger context of in the community. How can we do these things together and work together to make a difference for both ourselves as an individual and all the community and individuals involved. So that was quite a bit about stress management. I brought in some things that we talked about previously about diet and exercise, just because those are the foundation of blood pressure management. But I'm really curious again about the things that we have talked about additionally. Who can you talk with? What information do you have that you can share? Who can you walk with? If you're a provider, how can you create a safe space for your patients to talk with you? I think yeah, we still have about 15 minutes. So at this time, if you have other questions that you want to talk through, or just strategies that you're interested in employing, I'm really interested in hearing what you have to say, and talking about those with you. So I'll give you just a few minutes to put in the chat and Q&A what you're thinking. And I think my next slide, um, I'll leave this up my contact information. All right. Ah, so Kristen, that's a good question. Is there a best time of day to take a blood pressure reading, or any tips for getting the best reading. So, the first one, the best time of day is when you're going to take it. I'll say that. It depends on your work schedule and all the things you're having going on. So we used to recommend that patients measure their blood pressure in the morning. But if you work nights and that's the end of your day, then maybe that's not the best time for you. So in general, I'll say the best time is when you're going to measure it, when it works for you is great. I will say, so if you start measuring your blood pressure in the afternoon, I would continue with that because your blood pressure fluctuates from moment to moment, and then depending on what's happening. And so if you start measuring it in the afternoon, I would continue with that trend. But otherwise, I won't say that there's a best time of day, because that may not be something that individuals can stick to. Tips for getting the best reading? Absolutely. And so, one of the things is that you should be sitting still for 5 minutes before you measure your blood pressure. And I think sometimes that's one of the hardest things for us to do because we're sitting still and then we think about laundry or someone comes and asks for something. So, creating a space where you can sit still for 5 minutes. You want to sit in a chair or on some type of platform where your back and your feet are supported. So, you don't want your legs hanging and swinging. You want to be able to lean back into your chair so that your back is supported. You want to follow the recommendations on your cuff, but you want to make sure that your cuff is placed appropriately based on the type of cup that you have. You also want your arm to be at heart level and to be resting on something. So right now, I'm sitting in a chair with my back supported. I'm at the table. I could put the cuff on my arm and rest my arm on the table, and it'll be right at heart level. And so I think those are the best recommendations. Oh, I should say this too. No talking. So no cell phone on speaker. If someone's coming in, just tell them to just give you a few minutes. But no talking, no swinging your feet, uncross your legs. Just make sure that you're as still as possible. And that is how you are going to get the best reading. Thank you so much. That's a great question. Deborah says, find out your DNA. If your parents and grandparents are available as family members that they have high blood pressure, absolutely. Walk is free and you don't have to join a gym. Excellent selection. So let's talk about family history. Family history is very important. One of the myths about hypertension, though, is if your parents or grandparents have hypertension, you have to have it. That is absolutely not the case. It's something you want to be aware of. But again, there are some things that you can do to mitigate. So you are at increased risk, but you won't automatically have hypertension just because family members have. But I think it's important to understand um, your parents and grandparents, their health history, what medications they might be taking, and ways that they've worked to control their blood pressure and mitigate their risk already, because that can be a very helpful foundation of information to start with. Walking is free, and I think we talked about walking, Deborah. I agree with you. Walking is great as far as getting the number of steps in each day, being more active. You don't necessarily have to lift heavy or sweat vigorously if you are interested in cardiovascular benefits. Now, if you're interested in weight loss and training, that's a little bit different. And there might be different recommendations there. But just for cardiovascular benefits or just for protecting your brain, like we're talking about today, walking is a great exercise. Your heart loves it and your brain loves it.
I love to use walking for stress management as well. Like
Yes.
it's just getting out on a nice day and doing walking downtown or walking, with a purpose or without a purpose. It's, for me, it's very helpful just to clear your mind.
Yes, that's a great point, Stephanie. And I think too, So walking in general is great, especially like so if your office is downtown, just getting out there. But if you can be purposeful in when you're walking as well, there's research to show that a walk away from like stoplights and crosswalks and cars, that's actually very restorative and has lots of benefits to walk in nature. So it's quieter, you get to take in nature, you're in awe of the beauty around you. So there's even more benefits if you're able to get out and walk in like the Arb or botanical gardens. I used to do that sometimes if I could get away on break and walk through there. So that's a great point. Thank you for bringing that up, Stephanie. Okay, I don't see any additional comments in the chat or in the Q&A. So I'll just, whoops, I wanted to go back. Oh, no, not mail. Hopefully that won't open. Okay. So we achieved our goals for today. We did a brief overview, had a better understanding of just what's happening when we measure blood pressure, what's happening with the brain and the heart and the connection. We also reviewed some strategies and talked about how we can employ them in our daily lives or talk to someone who may benefit from making some of these changes. And then we consider personally for ourselves or for the community at large and anyone in between of how we can eat better, be more active, and reduce some of our stress. And so I will say here on these social media platforms, each year I work with undergraduate students, and what we do, I teach them two things. So, first, we pull articles, so current literature on self management strategies and hypertension. We focus specifically on Black women because that is my population of interest. And what we do is the students learn how to take that scientific evidence and put it into lay information in lay terms. And then we post short, digestible things. So as you're scrolling through your timeline on social media, you can briefly see it. You can click on it if you want more information, or you can just take the little nugget that we offer you and decide if that works for you. And so during the semester, we post 2 to 3 times a week, and we talk about diet, exercise, stress management, all the things that we talked about today. And then we offer those nuggets specifically related to what we find in the evidence for current evidence to share with those who follow us. So if you are interested in learning more about how we do that, I have listed the pages there. Thank you so much for the invitation to be here, and I hope you all enjoyed this conversation as much as I did today.
Yeah, thank you so much, Dr. Jones. That was a really great talk. We look forward to having you back in the future. If anybody has any questions, feel free to email me and I will pass them on to Dr. Jones. If not, expect that follow-up email tomorrow, and I look forward to working with you all in the future again. So,
All right.
see you later.
Thanks. Take care.